The first thing I'm going to mention is chiropractic. It is the best thing that you could do. I always tell moms before you even think about getting pregnant, get chiropractic care. You want to prep the house to make sure it's all ready to go for the guests to come in so it can have a very enjoyable experience through that. Plus, it's going to make your experience less stressful. All the things that they talk about what you may experience through pregnancy, it minimizes that. No guarantees to clear them all out, but it will minimize like morning sickness and fatigue and energy lows. Now, there's other things you can do for that too, but the key factor is it minimizes all these things. It reduces the labor and birth stress on baby and mom. It helps with trimester 4, which not a lot of people talk about. And so these are all variables that will help with. And this is why chiropractic is critically important before the planning stages. But if you're already pregnant, we can help there too. So we have a technique called Webster. And Webster technique is a specific chiropractic analysis of the sacrum. And we're looking how the sacrum is in position. And then we're looking at musculature and ligaments around the area and how are we going to help position the pelvis and sacrum to be in the most optimal state. Because when we can get things better in alignment, then all of a sudden baby will have more movement. There's less restrictions on baby. And usually this is why people say chiropractic turns babies, but we don't, because our approach is pelvis and sacrum and soft tissue around the area. So when we work on that sacrum, which is an upside down triangle bone, and then work on the pelvis, you have to understand in the uterus, there's many ligaments that attach to it. A lot of women think of the round ligament. That most pregnant women I work on, they usually know what the round ligament is. And if you think of like a hot air balloon, it's ligaments that come from the top portion of the first third of the uterus, attaches down to the pubic bone. So this can deviate or tilt, right, if one's tighter than the other. There's another one in the pelvis called the broad ligament. I'm going to use my hands as an example, but imagine your uterus in the middle, and you have these finger-like projections that attach into the pelvis. So if your pelvis is rotated in some way, shape, or form, those broad ligaments can be shifted and it can twist or turn that uterus a little bit.